All right, so part 4 is going to be on exercising in cold environments and how we adapt. First thing we need to know is that humans have much less capacity for adaptation to long-term cold exposure. Um, Cold exposure results in an increased rate of heat loss to the environment due to steeper temperature gradients. However, the body has fewer physiological mechanisms to prevent the heat loss, as well as a limited capacity to generate heat. So first and foremost, one of the main changes in our energy metabolism is we do shivering. All right, so what shivering is, it's an involuntary, repeated, rhythmic contraction of the skeletal muscle. It increases heat production. All right, a problem with it is prolonged shivering can result in the depletion of glycogen stores and the inability to maintain our blood glucose levels. So when we shiver for a long period of time, we use a lot of glucose or we use a lot of energy. You also can see in the picture here vasoconstriction. If you look, this first picture is right when we lay our hand on a cold apparatus, whether it's ice or submerged in super cold water. So we can see that as we put our hand on it, we have vasoconstriction. So we lose heat from the center of the hand. We get more purple or more blue around the areas. So the reason why this happens is because of vasoconstriction. Vasoconstriction is on the skin surface, which decreases the rate of heat loss to the environment. So cold stress is different between individuals based on gender, body mass, age, and then short-term acclimatizing mechanisms, whether it's habituation, metabolic acclimatization, or insultive acclimatization. Okay, so those are some short-term effects. When we look at the individuals for long-term adaptations, you see changes in the body. So over here, this would be someone who lives in the Arctic versus someone who lives in sub-Sahara Africa, the hot climate. You notice they're very long and lean, and here we have more mass around the midsection. All right, so this is what's called Bergamon's rule and Allen's rule. So when we look at factors that affect cold, we're talking about wind chill. And what is wind chill in relation to body heat loss? First off, we have to look at the wind speed. The wind speed gives a decrease in air temperature felt on the body due to the flow of air. This is known as the wind chill effect. All right? So with wind speed, let's say it's negative 10 degrees Celsius. If wind speed is 5, it's going to feel negative 13. If wind speed is 30, it's going to feel negative 20. All right, so you notice here in our chart where the different areas we have some major freezing risks. Definitely here in the red, you notice there's a large area. Severe risk, meaning if we're out in the cold for more than 10 minutes, we're probably going to have some hypothermia or frostbite type situations based on wind speed. So that's why in the wintertime, wind is very important to understand how it affects our heat loss and heat gain in the body. Cold water is very challenging to the body when we talk about thermoregulation because water has a much higher specific heat capacity than air, which means that raising the temperature of water takes a lot more time and more heat energy than the same volume of air. Right? Water also has a much higher thermal conductivity, meaning that water conducts heat much better than air does, and heat loss with conduction is greater. So when we are in cold water, the body goes through 4 phases. Okay, first we have the cold shock response, which is typically 1 to 3 minutes. This is when we typically, jump in a pool and we have that large inspiratory gasp of feeling cold. Typically in super cold environments, it's followed by severe hyperventilation, which then means if you are submerged, you start inhaling water. Right? Sudden immersion can also cause muscle spasms in the skeletal muscle. Secondly, you will have cold incapacitation, which takes about 5 to 15 minutes depending on the temperature of the water. This is where your periphery constricts, so blood flow to the hands, the arms, the feet start to constrict, and you lose control of muscle coordination. If you're in the freezing cold water for more than 30 minutes, you typically will have hypothermia. And again, it depends on the water temperature, your body size, the level of your insulation, not just your fat cells, but the types of clothing you have on, and how acclimated you are to the cold. Right? So these are different techniques. You have the HELP technique and you have the huddle technique. HELP technique, it's heat escape lessening posture. So it's semi on your back with your knees slightly tucked. Huddle is when you have more people together and you huddle together to keep warm. So on this page you see some boater safety tips. Get out of the water as soon as you can. Remain calm. Things you should expect: panic and shock, gasp reflex, hypothermia, and death if you don't get out of the cold water sooner than later. So what is hypothermia? Let's go back up on this side. Hypothermia is where the core body temperature drops below 35 degrees Celsius. Hypothermia is dangerous because it slows metabolic reactions below the rate required to sustain life. So if you look here at the temperature scale, and here's Fahrenheit and here's Celsius. So if we are at 37.6 degrees Celsius, which is normal, it's about 99 degrees Fahrenheit. All right, we start going down, we might have mild conditions of hypothermia. When we get below 97, we might start having moderate conditions. But when our body temperature gets way down here to 82 degrees or below 90, we are in the severe stages of hypothermia. All right. Treatment or symptoms would be shivering has stopped. We're typically confused, clumsy, slurred speech, might be semi-comatose, and our muscles might be rigid. So in this situation here, we would want to call 911, treat them for shock, and then avoid jarring the victim. So we want to handle them very cautiously and apply mild heat to the heat and head and neck to keep temperatures from dropping even more. So those would be the severe cases. Probably something you may have experienced would be shivering, cold hands and feet, numbness in your limbs. So that would be when you're out in the cold, say at a football game in mid-December, and you're out there in the cold and you start to experience these conditions because you've been out there longer than 30 minutes. Right? You would want to apply gentle heat, help the victim exercise, keep the victim warm for several hours. Right? Frostbite and frost nip. These are two different things that can also happen in the cold. Okay, both of these are freezing of the skin, and the difference in name has to do with how much damage is done. All right, prolonged exposure to the cold is vasoconstriction, to the extent where tissue dies from lack of oxygen and nutrients. So when our fingertips get red, we have what's called frost nip. And then you might start to see some blisters, and that's called superficial frostbite, little ice crystals on the membrane of your skin. And then deep frostbite goes into the different layers of the skin. All right, so with frost nip, probably have experienced that before when we have wanted to make snowballs or have a snowball fight, and our hands get really cold. Simple rewarming of the affected area typically takes care of it. Frostbite, on the other hand, can be a medical emergency, especially severe frostbite. It's where the skin turns white or blue, or it's molted, means it kind of shrivels up. Even when we do rewarm the bodies, they may or may not regain function depending on how long you've had the frostbite. So here's another page that kind of tells you the difference in frostbite, hypothermia, how you treat the victim. All right, so when we exercise in the cold, we need a barrier, and some clothing these days give us that barrier so we can still exercise. Sometimes we have a base layer, a mid layer, and a shell layer, and they have different characteristics. So where we talked about heat, and we talked about we needed conduction, convection, radiation, and evaporation, with cold disorders, we want to reduce those thermal conductions. We want to reduce the heat loss. So now we need to trap the air in our body so we don't lose body temperature. All right. So the way we do this is by applying different layers. So things that we might want to wear, if we're just trying to block the wind, block the rain, we could wear a shell layer. All right, something that's waterproof, windproof, and breathable. Typically a Gore-Tex type material. If we're needing a little bit of insulation, that's breathable, but it helps us to stay warm. This is typically thick and fluffy, and it traps air. These would be your fleeces, your micro fleeces, your down jackets. And then our base layer, the one closest to our skin, needs to have breathability. It needs to have breathability so it can wick away the sweat so it doesn't remain in contact with the skin. So these are our things called dry fit or thinsulate. They are synthetic just like the others are. So what it does is it traps a layer of air close to the skin so that we don't lose heat, right? So this layer should be fitting without large gaps, but it shouldn't be super tight that it's uncomfortable, right? The other thing is we need to look at the head, the face, your ears, your fingers, and your toes, which typically lose heat pretty fast too. This brings into the topic of layering. Layering is very important when we are in cold conditions. So the things that we wear should be selected to suit the temperature, the weather conditions, and the nature and duration of activity. If we have too much clothing, sweating may occur and decrease the insulative values of the clothes. So here's some different layers. So if we're doing some cold weather hiking with moderate intensity, we would need a base layer, which is going to be tight to our body, a middle layer, which is going to be a long sleeve shirt or some hiking pants, and then we have a rain jacket in case it starts to storm. All right. And that finishes up the physiological factors and performance with this section.